Okay, let me ask you this. Where do you feel most comfortable, most, cared for? I bet for a lot of us, the answer is home. It just has that feeling, right? Security, familiarity. Well, what if that feeling, that comfort, could actually extend to cover all your professional, medical, and personal care needs? Because, well, that's pretty much what seems to be shaping the future of healthcare. Today, we're doing a deep dive into the, frankly, booming global market for home care services. Yeah, and our insights for this one, they come from the Global Home Care Services Market Forecast Report. And our mission today is pretty straightforward. We want to unpack the really significant growth in this market. We need to understand what services it actually covers and then explore its global reach. And honestly, it's pretty incredible future projections. It's quite a fascinating look into maybe a quiet revolution in how we get care.
It really is. And what's interesting is how the source defines home care services. It's not just one simple thing. They position it as a really critical part of the whole healthcare and support services picture. It covers both medical and non-medical care, crucially, delivered right there in a person's home. So, we're talking about a whole range of personal help, like with bathing or dressing, skilled nursing care, rehab therapies, and even things like just companionship, basic support. And if you think about why it's growing so fast, well, it links directly to these big universal trends we're seeing everywhere. It's almost perfectly designed, really, to cater to aging populations globally, and also for patients managing chronic conditions, or really anyone needing long-term care but wanting to stay independent at home. Plus, there's this bigger goal for health systems worldwide, right? They want to cut down on those costly hospital readmissions and really boost the quality of life for people, letting them stay in their own comfortable space.
Okay, let's get into some of these numbers then, because they really are quite eye-opening. The overall growth globally is just dramatic. So back in 2021, the market pulled in sales revenue of just over $430 billion, which, I mean, that's already a huge number. But check this out. It's projected to jump to over $640 billion by 2025, and then it just keeps climbing, expected to hit an astonishing $1.4 trillion by 2033. That's, wow, nearly tripling in just over 10 years. And that growth rate, the compound annual growth rate, or THGR, from 2025 to 2033, it's calculated at a pretty solid 10.51%. So for anyone maybe less familiar, that basically means it's expected to grow, on average, by over 10.5% every single year during that period.
Yeah, those numbers really paint a vivid picture, don't they? It signals a fundamental shift, a restructuring maybe in how healthcare is delivered and, well, used around the world. This kind of rapid expansion, it's not just a fleeting trend. It really reflects a growing global reliance on in-home care. It's becoming not just the preferred choice for many, but often the most effective way to manage long-term health. It definitely suggests a big systemic shift, moving care away from institutions and more towards personalized, community-based approaches.
Right, that huge global figure gives us the scale, but where is this really taking off most strongly? Let's maybe zoom in a bit. The report mentions North America as a really substantial market already.
Oh, absolutely. North America is a powerhouse here. Its revenue in 2021 was about $145.5 billion. That's projected to grow to nearly $214 billion by 2025. And looking further out to 2033, the expectation is around $461.5 billion. That's a CGR of just over 10% between 2025 and 2033. So very strong growth.
And within North America, the U.S. is the big one.
Definitely. The U.S. market alone was about $170.5 billion back in 2021. That's expected to rise to roughly $171 billion in 2025. And the projection for 2033, over $361 billion. Massive. Canada's significant too, though. It was around $22.4 billion in 2021, growing to almost $35 billion in 2025 and hitting nearly $84.5 billion by 2033. And Mexico, while smaller, shows the same pattern. $5.7 billion in 2021, $8.1 billion in 2025, and forecasted around $15.7 billion by 2033. So you see this trend right across the continent.
Okay, let's hop across the Atlantic then. Europe, also a huge market, right?
Very much so. Europe's numbers are quite similar in scale to North America's, actually. It was valued at about $118 billion in 2021. Projected to go to around $172.5 billion by 2025. And the forecast for 2033 puts it at over $368 billion. The TAGR there is just slightly lower, 9.957%, but still very robust growth.
And who are the key players in Europe?
Well, you've got several major countries showing strong numbers. The UK, for instance, $16.2 billion in 2021, projected at $23 billion in 2025, and then $46.4 billion by 2033. Germany's even bigger, nearly $23 billion in 2021, $33.2 billion in 2025, and expected to reach $70 billion by 2033.
Wow, $70 billion in Germany alone?
Yeah. France is also substantial, $17.2 billion in 21, $25.3 billion in 25, and looking at almost $55 billion in 2033. Italy, around $13.8 billion in 2021, growing to $20.6 billion in 25, and over $38 billion projected for 2033. Spain's on a similar track. $7.9 billion and $12 billion, then almost $28 billion by 2033. And you see steady growth, too, in places like Sweden, Denmark, Switzerland, Luxembourg. Even the rest of Europe category collectively grows significantly, from about $5 billion to over $13.5 billion by 2033.
Okay, but you mentioned one region having the most impressive growth rate. That was Asia Pacific.
That's the one. Asia Pacific really stands out in terms of, well, speed of its expansion. The market size there was about $110 billion in 2021. That's expected to jump to over $168 billion by 2025, and the projection for 2033. Nearly $400 billion, $396.463 billion to be precise, and its CAGR from 2025 to 2033 is projected at 11.291%. That's the highest we've seen.
Nearly 400 billion.
That's
That's huge. Who's leading the charge there?
China is a major driver. It had revenues of about $36.6 billion in 2021. That's forecast to be $55.5 billion in 2025, and then exploding to over $127 billion by 2033.
Right.
Japan is also very significant given its aging population. It was $19.2 billion in 21, projected to $28.7 billion in 25, and reaching nearly $64 billion by 2033. That's more than quadrupling.
Wow.
And you also see substantial increases across South Korea, Australia, Singapore, Southeast Asia, Taiwan.
Wow.
The whole region is booming.
So we've covered the big three: North America, Europe, Asia Pacific. What about other parts of the world? Are we seeing similar upward trends?
Absolutely. The growth story is remarkably consistent, just on different scales. Take South America. The market there grew from about $25 billion in 2021 and is projected to reach almost $88 billion by 2033. Brazil is a huge part of that, going from roughly $10.7 billion to over $37 billion. But you also see upward trends in Argentina, Colombia, Peru, Chile. The rest of South America collectively grows too.
Okay. And the Middle East? Africa.
Same pattern. The Middle East grew from around $11.6 billion in 2021, and it's expected to hit nearly $43 billion by 2033. You see significant gains in places like Saudi Arabia, Turkey, the UAE, Egypt, Qatar, and Africa too. Its home care market rose from about $20.7 billion in 2021 and is projected to reach over $71 billion by 2033. Nigeria shows strong growth from $9.2 billion to over $30 billion. South Africa as well, from $8.1 billion to nearly $30 billion. The rest of Africa contributes too. It's really quite universal.
That global consistency is striking. So looking at all this data together, what does it really tell us about where healthcare is headed? It's clearly not just a niche thing anymore.
No, not at all. I think it's, well, what it tells us is that even though the market sizes and maybe the specific growth rates differ by region, the core reasons behind the growth, aging populations, more chronic diseases, and just that fundamental human desire for care in a familiar personal setting, those are universal drivers.
Yeah.
It's powerful evidence that this shift towards home-based care isn't just a preference, it's becoming a really foundational model for healthcare delivery. It's genuinely transforming how care is provided and I think how individuals experience it on a very personal level all across the globe.
Yeah.
It really underscores that idea that for many people, especially when it comes to health and well-being, there's just no place like home.
What a fascinating dive into this market, that idea of it nearly tripling globally to over $1.4 trillion by 2033. It's just a staggering number. It really highlights how much value we're all placing on, well, convenience and comfort, doesn't it? Especially for something as vital as personal and medical support.
Absolutely. And if you take a step back from just the financial figures, which are impressive on their own, this massive shift towards care happening in the home raises so many interesting questions for the future, doesn't it? Like, what does it mean for how we design our communities, our actual houses, our neighborhoods, if more care happens outside hospitals and clinics? How does it change the role of family caregivers who, let's be honest, are often already doing so much?
Yeah.
And, what about technology? What kind of tech integration will we see becoming standard in our homes to support us as we age, to make this model work seamlessly?
Exactly. Really good point. Something for you, the listener, to think about. How might these trends affect you, or maybe your family, your loved ones, in the years to come? And what kinds of new ideas or innovations do you think might pop up to meet this huge growing demand for care right where we live? Okay, so imagine this quiet revolution, right, happening in homes like all around us. It's really shifting how we think about care, comfort, aging itself. Welcome to the deep dive. You know the drill. We take this big stack of sources, articles, research, our notes, and we boil it all down to give you the the really potent stuff, the key
Yeah, it has to be essentials.
Exactly. And today, we are diving deep into the world of home care services. It's changing fast.
It really is.
We're going to unpack some, frankly, eye-opening facts, and by the end, you'll have a much sharper handle on an industry that's not just growing, it's reshaping our future.
That's a great way to put it because, the fascinating thing here isn't just that the home care market is expanding. It's bigger than that. It's really undergoing this profound evolution.
Okay.
It's not just about demographics, though. That's huge. It's this complex mix of demographic shifts, yes,
Yeah.
but also big technological leaps, and fundamentally a shift in what patients and families actually expect from care now.
Right. Expectations are changing.
Definitely. So today, yeah, we're going to really dig into those core forces pushing its growth, the serious challenges it's grappling with, and also the really exciting trends that are, well, basically rewriting the rule book for its future.
Okay, let's pull back that curtain then. Where do we start? What are the absolute biggest forces, fueling this incredible growth in home care right now?
Well, look, probably the most powerful driver, you just can't ignore it, is the reality of our aging population globally.
It's undeniable.
It really is. And it's not just that people are living longer. It's the speed at which the global population is aging. You see it starkly in places like Japan, you mentioned. Over 28% are 65 plus.
Wow.
And across the U.S., Europe too, this demographic wave, it's not just increasing need, it fundamentally changes how we even approach care.
So more people needing help for longer.
Exactly. It leads directly to this huge demand for help with, daily activities, managing chronic diseases, which we'll get into, and even recovery after surgery.
Right.
And what's key here is people overwhelmingly prefer to get care at home compared to, say, a nursing home.
Yeah, who wouldn't?
It feels more personal, right?
Right.
And crucially, it's often cheaper. Plus, you've got governments actively pushing aging-in-place initiatives.
To keep people out of expensive hospitals and facilities.
Precisely. It eases the burden on the traditional healthcare system and, at the same time, creates this steady demand for both skilled nursing and non-medical support delivered right there in people's homes.
That makes a ton of sense. But it's not just about getting older, is it? You mentioned chronic conditions. We're seeing more people living longer, but with really complex health problems.
It's exactly right. That's the second major driver, this escalating burden of chronic diseases.
Like what specifically?
Well, think about conditions like diabetes, Alzheimer's, heart disease, arthritis, things that are just becoming more common.
Right.
And these conditions demand ongoing, sometimes daily, medical attention. So what's happened is home care agencies have really stepped up. They've dramatically expanded their services.
Beyond just basic health.
Oh, absolutely. They're now offering, medication management, wound care, physical therapy, even quite sophisticated monitoring for chronic diseases at home. And patients, they genuinely benefit from recovering in familiar surroundings. There's greater comfort, a sense of normalcy.
Yeah, I can see that.
And here's a really important shift, value-based care. You hear that term a lot.
Explain that quickly.
Sure. Basically, it means insurers and government programs are starting to pay for positive health outcomes, not just for every single service delivered. Volume isn't the goal, health is.
Okay, got it.
And because home care often leads to good outcomes, especially after hospital stays, more of these home-based services are getting covered by insurance.
So the payment models are catching up.
They're starting to. And that reinforces long-term growth for home care and helps keep patients within that model because it's actually being paid for.
So, okay, it's often preferred for comfort, it handles complex chronic issues, and there's a serious financial case for it, too, especially with healthcare systems being so stretched.
Precisely. That's the third key driver. Plain old cost effectiveness. Especially after something like COVID-19, healthcare budgets are incredibly tight. Hospitals are often full. Home care offers a genuinely viable alternative from a financial standpoint.
How so?
Well, it significantly cuts down on the need for long, expensive hospital stays, and it helps make that transition from hospital back to home much smoother, which also prevents costly readmissions.
Right, that revolving door issue.
Exactly. And we're also seeing cool innovations like telehealth visits, remote monitoring, using sensors. These things actually improve clinical outcomes while lowering costs.
So technology is helping the cost argument, too.
Absolutely. It really demonstrates that home care can be both, affordable and effective. High-quality care doesn't have to mean a hospital bed.
Okay, it's really easy to see why this market is just booming. The drivers are powerful. But as we peel back the layers here, It's not all smooth sailing, is it? Despite these strong tailwinds, the industry faces some really tough challenges.
That's the flip side, yes,
Yeah.
a crucial point.
So what are some of those critical headwinds? What's holding it back?
Well, probably one of the most urgent problems is a severe shortage of skilled caregivers.
The workforce issue.
It's huge.
Yeah.
This sector is really wrestling with high turnover rates, a lot of burnout among staff, and, let's be honest, often inadequate pay.
Hmm.
And all that severely limits the number of available trained nurses, aides, therapists, the people you actually need.
Is it worse in some places than others?
Oh, definitely. The challenge is particularly sharp in rural areas and underserved communities generally.
Right.
And frankly, unless this is tackled head-on through things like better wages, improved benefits, solid training programs, maybe even looking at immigration policies, these workforce shortages are just going to keep hindering the ability of home care to scale up reliably.
That's fundamental. You can't deliver service without the people. What about keeping the quality consistent? It's such a spread out model, care happening in individual homes.
That leads us right to the next challenge,
Hmm.
quality and compliance.
Uh,
See, unlike a hospital or even a nursing home, which are centralized environments, home care happens, like you said, in someone's living room. That makes standardization really, really difficult.
yeah, how do you ensure everyone's doing things the same way, the right way?
It's tough. You often find big variations in caregiver training levels. There's often limited direct supervision compared to a facility setting, and regulatory oversight can be inconsistent across different regions or types of care.
And that leads to.
Well, it can unfortunately lead to uneven service quality. Now, many providers are using digital tools, electronic health records, or EHRs, tracking apps for better documentation and oversight.
Okay, so tech helps there too.
It helps, but there are still gaps, especially in what's called non-medical home care, help with bathing, meals, that sort of thing. Standards there can sometimes be less strict, and that unfortunately can impact patient safety and ultimately erode trust in the service.
That's a serious concern. And even with all the benefits we talked about, comfort, cost effectiveness, is getting access still a hurdle for many families who desperately need this care?
Absolutely. That's the final critical restraint we need to talk about. Affordability and these persistent insurance gaps.
How so?
Well, in way too many places, insurance, whether it's public or private, will only cover services that are deemed strictly medically necessary.
Okay, so like wound care might be covered, but.
But essential help with daily living, bathing, getting dressed, meal prep, help moving around, sometimes even just companionship to combat loneliness that often doesn't qualify.
So families have to pay out of pocket.
Very often, yes,
I know.
entirely out of pocket. And that creates a huge financial barrier.
Meaning only wealthier families can afford it.
It often means access gets limited to higher income households, or maybe people living in urban centers where there might be more subsidized programs. It effectively shuts out a large group of people who have a genuine clinical need but just can't afford it without better insurance coverage or more public funding.
Wow. Okay, so we've got this picture. Massive demand pushing growth, but also these really significant hurdles: workforce, quality, cost, and access. So what does this actually mean for the future? How is the market adapting? How is it evolving to try and overcome these challenges?
That's the million-dollar question, isn't it?
Yeah.
And it's exactly where we see some genuinely transformative trends emerging, things that are trying to address these very issues.
Like what?
Well, first off, there's a huge and rapid integration of technology. It's really accelerating.
We touched on that a bit with EHRs and monitoring.
Right, but it's broader now. Home care providers are quickly adopting tools like remote patient monitoring sensors that track vital signs, falls, things like that. Telehealth platforms for virtual check-ins with nurses or doctors.
Mm-hmm.
Even AI-enabled scheduling. That uses artificial intelligence to optimize caregiver routes, match the right caregiver skills to patient needs more efficiently, making the whole operation smarter.
So using tech to overcome the logistical challenges.
Exactly. These tools let caregivers and clinicians track vitals, do virtual visits, share health data instantly. Things like EHRs and even predictive analytics, using data to forecast potential problems before they happen. They're streamlining how care is delivered.
Helping reduce those hospital readmissions we talked about?
Precisely. And supporting service models that can actually scale up to meet the demand while maintaining or even improving quality.
Okay, so tech is making it more efficient, more data-driven, almost like creating a virtual command center for care in the home. What about the type of care being delivered? Is that changing too?
Yes, definitely. That's another major trend. The shift towards highly personalized and specialized care.
Moving away from generic help.
Totally. We're moving away from that old one-size-fits-all idea. Now, it's about creating customized care plans. Plans tailored specifically to an individual's unique health condition, certainly, but also their personal preferences, even their cultural background and needs.
Can you give examples?
Sure. We're seeing specialized programs popping up that focus specifically on, say, dementia care, or palliative care for end-of-life support, or mental health support at home, even specialized nutritional guidance.
So real niche expertise.
Exactly. And caregivers are getting advanced training in these specific areas, which does a couple of things. It improves patient outcomes, obviously, but it also really boosts client satisfaction. And interestingly, it seems to help with caregiver retention, too. They feel more skilled, more valued.
That's huge, tackling that workforce issue from another angle. Okay, so tech integration, specialized care. What about the business side? How is the industry itself structuring to grow and meet this demand, especially with those workforce and quality challenges?
Yeah, this is where the market structure itself is evolving quite dramatically.
Mm.
We're seeing significant expansion through two main avenues: franchise models and these increasingly sophisticated digital platforms.
Okay, franchises like Home Instead, Visiting Angels.
Exactly, those kinds of names. And companies like Honor, which operates more like a tech platform connecting agencies, caregivers, and clients, they're all leveraging these tech-driven ecosystems.
To do what better?
Primarily, to match caregivers with clients much more efficiently than traditional methods. Think better scheduling, location matching, skill matching. These platforms also improve transparency for families. They can help simplify compliance with all the different regulations, and they enable real-time communication and support for caregivers out in the field.
Right, so using tech to manage the distributed workforce better.
Precisely. And the franchise model, specifically, allows companies to scale up relatively quickly and expand into new geographical areas, including some of those underserved regions we mentioned earlier.
And is there money flowing into this space?
Investment. Oh, absolutely. There's been a significant influx of venture capital into home care technology and service providers. And that money is fueling innovation, it's paying for infrastructure upgrades, and it's also driving a lot of consolidation in the sector, companies merging or acquiring smaller players to gain market share and achieve greater efficiency.
So it's a really dynamic picture. You've got demographics pushing demand, technology enabling new ways of working, payment models slowly shifting, and the industry structure itself adapting through franchises and platforms. It's clear that the whole home care landscape is being reshaped by this powerful convergence of forces. Our deep dive today, I feel like it's really pulled back the curtain on an industry at this pivotal moment. It's responding to immense pressure with some incredible ingenuity.
It truly is. It's this fascinating blend, as you say, demographic demand meeting digital transformation, meeting decentralization.
Yeah.
It's all shaping a home care industry that's trying to become more resilient, definitely more personalized, and fundamentally ready for the future.
Yeah.
And maybe, as a final thought for everyone listening, consider the broader implications of all this. These shifts, they're not just changing healthcare systems globally. Think about what it means for our communities, for individual well-being, for autonomy as we age.
Right. It affects us all eventually.
It really does. So maybe reflect on how these transformations might impact your own life or the lives of people you care about, and perhaps even consider what role could you play in advocating for supporting a home care system that's truly robust, person-centered, and future-ready.